You ever wonder if one person's story, one single life, could actually spark a revolution in a country's healthcare? Well, today, we're going to Bahia, Brazil, to dig into a story of tragedy, incredible resilience, and the very real fight for maternal justice. This is a really crucial part of the global Black lifespan journey, and trust me, it tells us so much about the world we're living in today. Hey everyone, welcome. We are about to unpack a really complex issue that sits right at the intersection of healthcare, human rights, and racial equity. It's a story that, yes, starts with a tragedy, but you'll see how it grows into this powerful movement for change that's still happening as we speak. And that question, it's not just a what if. It's the real-life story of one woman whose experience sent absolute shockwaves through an entire nation. It forced a total reckoning with a system that was just broken. Her story is really at the heart of everything we're about to explore. Okay, so let's start with a name, Alyne Pimentel. Her life was cut tragically short, but her legacy has become this incredible force for reproductive justice all across Brazil. Alyne was a young Black woman who died from a totally preventable pregnancy complication. She was failed by the very system that was supposed to protect her. I mean, her case was so bad that it actually led to Brazil's first ever international condemnation for maternal mortality. Think about that. Her death wasn't just another number. It was a blaring alarm, a symbol for countless other women who had been suffering in silence. Now, Alyne's story, as heartbreaking as it is, it's also a window into a much bigger crisis, the hidden toll of birth trauma. And this crisis really has two faces, the systemic violence that happens during childbirth, and then the devastating mental health fallout that comes after. So when we use this term, obstetric violence, what are we actually talking about? Look, this is not just about a tough birth. We're talking about a violation of human rights. It's any action, or just as importantly, inaction, by a health professional that disrespects a woman's body, her choices, and her emotional state during one of the most vulnerable moments of her entire life. And when you see what this violence actually looks like in practice, it is just shocking. We're talking about dangerous physical stuff like the Christeller maneuver. That's basically a doctor forcibly pushing down on a woman's belly, or performing an episiotomy without even asking for consent. It's verbal abuse, being denied your legal right to have a companion with you. The list goes on. And let's be clear, these aren't just one-off bad days. They're patterns of disrespect and actual harm. The scale of this is just staggering. A major study found that 1 in 4 women in Brazil reported experiencing some kind of obstetric violence. Just let that sink in for a second. 1 in 4. This tells you right away this isn't about a few bad apples. No, this is a systemic problem that's woven right into the healthcare system itself. And of course, the trauma from these experiences, it doesn't just vanish when the baby is born. Not at all. Research, including from the Federal University of Bahia, shows a strong, direct link between obstetric violence and postpartum depression, or PPD. The physical and emotional scars from a traumatic birth can cast a really long shadow over a new mother's life. And you can see from this data, what we're looking at is a full-blown national mental health crisis. And look at the huge variation here. The national average for PPD is already alarmingly high at almost 20%. But then you see a city like Vitória, where it just skyrockets to nearly 40%. That is not random. It's a direct reflection of deep inequalities in care from one region to another. And behind every single one of those numbers is a mother just trying to cope. And right here, this is the absolute heart of the injustice. This is not a trauma that affects everyone equally. The research is crystal clear. The burden of obstetric violence and the PPD that follows falls heaviest on Black women, on poor women, and on those who have to rely on the public health system. It's a painful and undeniable example of structural racism and classism playing out in the doctor's office. So, okay, if this problem is so huge and so serious, you'd think there would be laws to protect these mothers, right? Well, that's where things get really frustrating because there's this huge hole in the system, especially in the state of Bahia. I mean, despite all this evidence, the state of Bahia, a place that is literally the heart of Afro-Brazilian culture, has no specific law on the books to define, prevent, or punish obstetric violence. This leaves victims in this legal gray area having to rely on general laws that don't even come close to addressing what they've been through. And it's not like nobody tried. Back in 2020, a really comprehensive bill was introduced. It was designed to do everything that was needed, clearly define the problem, guarantee a patient's rights, and hold people in hospitals accountable. But After years of just sitting there in the legislature, in 2023, the bill was just archived. It died without ever getting a final vote. Just gone. And what makes the failure in Bahia even more infuriating is when you look just next door. In the neighboring state of Sergipe, they recently passed a similar law. It just goes to show what's possible. This contrast makes Bahia's inaction look even worse and proves that this kind of legislative protection is totally achievable. Okay, so with the state-level action completely stalled, where do mothers in Bahia find any hope? Well, the answer seems to be coming from a major shift in federal policy. There's a new path being created, one that's designed to fix these systemic failures from the top down. For years, Brazil's maternal care plan was called the Rede Alyne, or the Stork Network. But in late 2024, they launched a brand new framework, the Rede Alyne. And that name is absolutely not a coincidence. It's named in honor of Alyne Pimentel, which brings her story full circle in a really powerful way. And the key difference? The old network was about general improvements. The Rede Alyne has a laser focus on reproductive justice and is explicitly designed to fight the racial and regional inequalities that cost people their lives. Let's just look at the core goals for a second. The Rede Alyne wants to do more than just make care better. It wants to rebuild it around the idea of equity. And that fourth point right there, that's the real game changer, putting a special direct emphasis on Black and Indigenous populations, the very people who have been most harmed. It also extends care for 2 whole years, recognizing that a mother and child's health are connected long, long after the birth. And this isn't just talk. The new policy has a concrete, ambitious, and measurable goal to cut maternal mortality for Black women by 50% by the year 2027. That is a massive statement of intent, and it turns Alyne's legacy into a national promise to save lives. So with this new federal plan just starting to roll out, what does the support system actually look like on the ground right now for mothers in Bahia? And what does the future hold? Let's take a look at the networks of care that are already making a difference. For women who are dealing with birth trauma and PPD in Bahia today, there are lifelines. The public system has a network of psychosocial centers called CAPS that offer therapy and support. For more serious situations, there are psychiatric hospitals. And, so importantly, universities and community groups are stepping up to fill the gaps, offering low-cost therapy and vital peer support, like the Rota Viva group, which empowers women through shared knowledge and solidarity. Stories like Alyne's are at the very core of what we do here at Afro-Mosaic Health Guide magazine. We really believe that by shining a light on these crucial health topics, we can empower our community and help create change. So if you want to join us on this journey and support our work, please take a second to subscribe to the channel. Your support is what makes these explainers possible. The story of Alyne Pimentel really teaches us that changing healthcare isn't just about new technology or new medicines. It's about rebuilding entire systems on a foundation of justice. So the question we're left with is, when we finally get it right, whose future can we save? Thank you so much for watching.